A very inspiring film, and we have an amazing panel for you here today. I first want to bring up Emily Rymland. Emily is a nurse who just stood up and went to Uganda and founded her own health clinic in very remote Western Uganda called Em's Health Clinic. And please have a seat and pick up a microphone. She just did this on her own, and she is running this clinic now. I also want to bring up another amazing nurse practitioner, Arlene Samen. She was inspired by the Dalai Lama some years ago to create an organization, One Heart Worldwide, that provides safe childbirth in Tibet and Nepal and has spread its model all over the world. Really. And the third person I want to bring up is Josh Nesbit. And Josh is the CEO and founder of Medic Mobil. And he's sort of representing for Partners in Health today because I hope it's okay to say he's sort of a protege of the people in Partners in Health, and he has created an organization which is working, what, in 34 countries, did you say? Something like that. Creating apps and giving technology to health workers in very hard to reach areas and doing really the impossible. I'm going to ask a couple of questions of our panelists and then open it to some questions from you. I guess just wanted each of you to sort of spin off from what you're feeling coming out of the film, what issues it has raised for you and how that resonates with the work that you're doing. And maybe just start close to me with Emily.
Hi. It's hard to see you, so I'm sorry if I'm glaring. What kept coming to me watching this movie, which was incredibly inspiring, is to not get overwhelmed by the need. Because I think sometimes when you see so much need, you freeze. And so to just take off a little bite is really an okay thing to do, because then, just like in this, the mouthful grows all by itself. And I think that's the one thing that I learned as I've gotten older, is to just say yes and see where you go, because you just shouldn't be afraid of anything unless you try it. And so all of a sudden, out of nowhere, I have this little clinic in Western Uganda that's serving a population of 4,000 that otherwise gets no help. And a school was created as well, because health and education go together. And 3 years ago, I had no idea that I was going to do this, and so yes is the word for me.
I came out of this film feeling, wow, I'm not the only one that has a lot of trouble getting care to the poorest of the poor in the most remote areas of the world. And that with sheer determination and never giving up hope, that you can and will accomplish just about anything. And so my hat's off to Paul Farmer and those that never gave up.
I've seen that film 3 times already. It reminds me of the work that community health workers do every day, for everything in their power for their neighbors. And for me, that was the moment I woke up. I was inspired by the book, Mountains Beyond Mountains, like so many in my generation. I thought I was going to be a doctor. That was my plan. I ended up working at a hospital in Malawi in southern Africa. There was a single doctor at this hospital serving 250,000 people, and patients were walking 100 miles to get to that hospital door. And then I met these community health workers who were doing everything they could every day for the village members around them, and were fighting for a role in that healthcare system. And it was so clear that we, all of us, the big we, could do so much more to support them. So really, my big takeaway from this film is I want to meet everybody in this room, and I want to treat this as a community and think about what we do together. That was my thought walking down the stairs.
That's really wonderful. This is a great audience we have here. I neglected to introduce myself, which I apologize for. I told you my name is Susan Stern. I'm a part of the wonderful independent filmmaking community in the Bay Area, and that's why I get to sit on this stage tonight. Are there some questions from the audience for any of our panelists? Raise your hand and a mic will come to you. We have one in the back.
So over here on your left, towards the back.
I wanted to agree with the statements about the community health workers. When I worked in Uganda, that was teaching physicians AIDS treatment. I was terribly impressed with the community health workers. I think the film underscores that. My question, though, is otherwise. I was also very impressed with President Bush's support of PEPFAR. I'm not totally impressed with the Tweeter-in-Chief, and I'm wondering how we perceive things are going to go when we don't have support even for healthcare in this country, let alone for healthcare elsewhere.
That's a very good question. I want to add on to that in terms of, is there anything we know in terms of the specifics of that about how the Trump budget is dealing with some of the major funds that are dealing with international health?
So my day job is an HIV practitioner in the East Bay, so I have a huge concern about HIV around the world, which got me to Africa in the first place. And the last I heard was 2/3 of the PEPFAR budget was going to go towards the military instead of PEPFAR. Right, so I think that we're in for a whole lot of work in figuring out how to acquire the antiretrovirals that are still needed, in addition to PrEP as entering, I don't know if you know what PrEP is, but PrEP is the medication you can take to prevent acquisition of HIV. We use it here quite frequently, and it would be an amazing thing to get across Africa. It's cheaper, it's easier, it's healthier as prevention. So, but I am horrified and very, very worried, and I don't think, do you have an answer? About where the money's going to come from?
So the day after the election in November 2016, I was on a plane to a refugee camp in Kakuma on the border with South Sudan and Kenya. And I was hearing about the upcoming existing cuts to the food budget, and that a 25% cut to that food budget meant 25% fewer calories for every family in that camp. And one thing I think we need to make very clear is the moral repercussions of cuts to global health. We need that message to be really clear. At the same time, I expect Americans and people in general to step up when other people step down and step back. I think that we're hopefully going to usher in a golden age of charity that will be this country's legacy. And it falls on individuals, and it falls on companies, and it falls on the people who step up.
And I'm quite concerned because maternal child health is my specialty about the cuts that are going to be made in this country to family planning, but I'm also deeply inspired to the women and men that took to the streets, and I think we are going to see more of that as these cuts happen in our own country, because it will increase maternal mortality here.
Looks like we have another question here.
Yeah, right here in the center.
I really wish I could spend hours raving about this film, but I know you're want to hear from other people. And I have a really burning question. The only flaw in this wonderful story is the murderous activities of the big pharmaceutical companies. I can't understand how they were given a pass by these incredible, courageous people who took on everybody else. If you think about the film The Constant Gardener, for example, and if you think about the fact that in Berkeley, I forget what year it was, we had die-ins in front of the Bayer Aspirin Corporation. We actually drove them out of Berkeley because we were so furious because they wouldn't lower the prices and would let people die in South Africa in particular. This is about AIDS. And they don't limit themselves to their murderous activities about AIDS. So I'm just wondering if anybody has an insight as to what happened about that very important, to speak sarcastically, partner in the debacles that we were seeing.
Probably nobody here can speak for the filmmakers about making that choice in terms of the film. Is there anyone here that wants to talk about?
I sort of have a personal response to that, if that matters at all, is that I'm dependent on those pharmaceutical companies at the same time of having a war with the pharmaceutical company. So taking care of people with HIV, if we boycott the drug, we boycott the life. And so somehow we have to continue working together and come around the other side and demand fair care, right? And I'm not sure how to do that yet. And I'm not sure the government we have in place right now is going to be very helpful. And again, I think this is something that needs to come from everyone again.
Okay, another question.
We have a question here in the back, in the center.
Okay.
13 years ago, I read Paul Farmer's book, Mountains Beyond Mountains, and I started an NGO that works in the Philippines. And we've been there for the last 13 years, providing medical care and building healthcare systems and services. I just want to follow up on a comment that was made about not getting overwhelmed by the fact that the problems are so big and that it takes a lot of resources to be able to have an impact. We are able to provide a lot of services for a very small amount of money. And I think that it's probably true of each of your organizations that you work with. While it would be great to have the federal government or the international community providing large amounts of money, there are lots of things we can do on a smaller scale that really make an impact. We can provide, for example, a year's supply of diabetes medicine for less than $6 a person. We can provide meals for people. For $5, we can provide 100 meals for individuals in the community in which we work, hot, nutritious meals. There are lots of other examples of that where our donors, our friends, our supporters are making a difference with small resources. Just want to add that comment.
Thank you, absolutely.
Thank you for that. And let me just, before I take another question, I'd be interested in what each of you would ask for people to do for your organizations or on this issue, or where they should keep, stay tuned to find out information about cuts. What do you need from the audience?
Money. No. I think you should find something that's important to you and work to support it. And I don't think you should wait for other people to do it. So whether it's your group or it's somebody right outside, you got to find it and do it, not think about it, not talk about it, but do it. And not know that there is no donation that's too small. I promise you that. $5. There really, people get like, I don't have a lot of money. Trust me, little bits of money add up to lots of money. So don't be stopped by, again, the overwhelming feeling.
And I'll echo that. I mean, every dollar counts, and we put it to good works to save lives, and every life matters. And so whether you choose to work in the Philippines or to work with homeless in San Francisco or Medic Mobil or One Heart Worldwide or her organization, just do something because we all make a difference.
I couldn't agree more. I would also say my guess is that in any room of people who have seen Bending the Arc, there's a handful of people who themselves or know a handful of people who are considering committing their life to this work. And I want them to reach out, and I want them to step into that. So it's really easy to find any of us on this stage, and I hope that you do.
Right, there's slides behind us, I think, that should have organizations. You can whip out your phone and take a picture or get in touch with us later. Okay, I think we have time for maybe about one more question.
So we have one here in the center again, towards the back.
So first of all, I want to thank all of you for coming and for sharing with us your stories also. The things that were in the movie were profoundly moving and that have been done in these other countries, but there are things that are there are needs that are equally present in our own country. And my question to you would be, the issue that I have is that if you take the African American community and the Hispanic community and you take our health, morbidity, and mortality, especially in the areas of maternal child health, and you strip out the Caucasian community, the maternal morbidity and mortality for African Americans, women, and infants is more than double that of the Caucasian population, which surpasses many, many third world countries in our nation. What recommendations would you have for us to be able to mobilize that sort of health care in our own country to affect our own people and increase the health status of Americans?
Jump in, whoever feels like it.
I'm very obviously passionate about that topic because it's what I've devoted my entire life to. I've worked on Native American Indian reservations in West Virginia and the Hollers and all over, and I think the #1 cause of maternal mortality in this country is lack of access and education, especially in the African American communities and Latino communities, and we all need to really address that with our senators and in congressmen and get out there and do something, because I think it's actually Ohio has one of the highest rates of preterm labor in the world. I mean, it's crazy, and it's young African American women. And I would love the opportunity to turn back that tragic tide of birth-related deaths here. I'll do it with Medic Mobil because we work together in Nepal, and so it's definitely on my bucket list.
Okay. I want to do two things. One is to say thank you very much to our panelists. You made my day. You made my week.
Thank you.
Just knowing about you makes me happy.